smoking cessation, getting to know your patient better. Taking evidence-based medicine and your clinical judgment and getting to know the patient, you can come up with a plan that's tailored for them, saving you time and at the same time getting your patient to their own health goals. I'm John Shaske, a clinical pharmacist for over 40 years, and currently I am a clinical instructor at the University of British Columbia. I have won several awards for innovation, both provincially and federally, and an Agent of Change Award from the University of British Columbia. Series 1, Episode 2, Smoking Cessation, Getting to Know Your Patient Better. By starting with point number 1, ensure the person actually wants to participate in coming up with a care plan. If they are really reluctant or not understanding why, you have to pause everything and have that discussion. Number 2 is how they feel about taking medications. Some people really don't want to take medications. Others are just happy to take the pills and just do what they're told. Find out what they really want to do and what they believe in. Now, what are the patient's own goals for number 3? Find out what's really important to them. So for example, if you're worried about their blood sugar and George, your patient, is more worried about running around with the grandkids on the field, and you find out that his inhalers aren't working properly, maybe that's what you could focus on. And at the same time, what is really interesting is because he's running around, maybe he can get his diabetes better under control. So number 4 is what are the most concerns that the patient has regarding their own health? Is there something that truly worries them? And that way you can set up their goals. Number 5, measure on a scale of 1 to 10 how well they feel about understanding their medications. And what's really important here is that they don't understand why are they going to take them in the first place. By understanding the importance and how it relates to their healthcare goals, the adherence all of a sudden goes way up and they're reaching their healthcare goals. Number 6, are there any barriers to treatment? As we'll see soon, cost is always important. If they can't afford it, how will they actually take it? But there's also other things as well. There's the understanding, there's their lifestyle. You need to know all those things, anything that gets in the way of them taking their medication. Number 7, does the patient use any compliance packaging? Some people feel that those compliance packages take away their freedom. Others think that it actually extends their abilities to do things. You need to find out what their beliefs are and which ones actually worked in the past, if any. 8, does the patient ever forget to take the medication? And I don't ask that question accusing them. What I do is I'll say, hey, when was the last time you forgot your medication? Or do you ever take longer than usual to fill your prescriptions? In a roundabout way to find out if they actually do understand things today. Number 9, learn what their lifestyle is like. Do they live alone on a busy work schedule? Are they totally retired and actually bored? What is it that their lifestyle is like, and how can you incorporate the plan into their existing lifestyle? And of course, 10, with our example of tobacco use, you need to ask them, do you smoke? Number 11, you need to know some other things about them. Their caffeine use. You need to know about their exercise, their diet, if they use any recreational drugs. 12, have any medications been added or stopped lately, and why? 13, does the patient know how to monitor for success on their medications? A lot of people are given the medications, but they don't know what to look for the improvements and when that should occur. And they just start taking the medications and keep on going. Or, on the other hand, they just stop because they don't know what to look for. So by knowing when to look for and what to do if things don't go as they're supposed to, people will be more involved with their plan. Number 14, is the patient aware of what side effects to look for and how to resolve those side effects and what to do if those side effects aren't resolved? Number 15, in the follow-up, is the entire healthcare team aware of what the tests are required, why they're required, and what to look for and how to communicate them to the patient? Number 16, You must listen with empathy to the person's story and keep an open mind. I like to think of it as a blank slate, and I don't project my feelings onto it, such as somebody that can't seem to get out of bed because of depression. I don't think, kick yourself and get going. What I do is I try to encourage them to look for little things that they like, look for victories, gain their self-confidence. I always like to do a head-to-toe physical assessment. Probably the best people to do it are the professional sport athletes that look at their competition and see where their strengths are, their weaknesses, and what they're doing. To be very aware of how they're doing physically, head to toe, but any expressions they have, anything that they say that gives me clues to where they are at physically and mentally today. Number 18, I ask basic adherence questions such as, when was the last time you forgot to take a medication? How many times did you forget? And those sort of things that I mentioned earlier with compliance packaging. Number 19, explore what brings joy to their life. If you have somebody with a diet and that they need to cut down, it doesn't mean cut out, it means to take things down a little bit and just have things as a treat as opposed to a lifestyle. Number 20, I discuss the evidence with the patient. I do it in such a way that they understand and that it is a balanced approach to the pros and the cons of the plan that we've got. And 21, finally check for understanding and make sure you've answered all their questions. That wraps up the 21 steps I take for getting to know my patient. I look forward to seeing you in the next episode, where we'll discuss how we apply our clinical judgment to the information that we've just discussed.